network of labs, hospitals, and community health centers that have been offering tests to a broad range of residents. Our goal is to continue to test large numbers of individuals across the state every day. Coupled with our contact tracing initiative, we'll use all available resources to understand and monitor infection rates and continue to contain COVID in our communities. Our administration is also broadening our approach to detect population-level screening for COVID-19. Last week, the Executive Office of Energy and Environmental Affairs announced a pilot program through the Massachusetts Water Resource Authority to test wastewater for early warnings of COVID-19 at the Deer Island Treatment Plant. Samples will be collected 3 times a week from different regions, with results sent to DPH. We're hopeful that this pilot can be another surveillance tool for the Commonwealth to monitor where COVID-19 exists, so that we can have a more targeted approach to quickly isolate and slow the spread of any infections. Yesterday, there were 101 new positive cases reported. The 7-day average for the positive rate remains at about 1.9%. That represents about a 93% decrease from the end of May. There are currently 762 patients hospitalized for COVID-19 statewide, including 138 patients in the ICU. My remarks say the end of May. I'm pretty sure that's the middle of April. Sorry about that. There are currently 762 patients hospitalized for COVID-19 statewide, including 138 in the ICU. I was on a call this morning with most of the hospital systems in Massachusetts. Those numbers fell again last night, which will show up in the reporting that's released today. The 3-day average number of patients in the hospitals is down 79%. 2 hospitals have reported they're still using surge capacity to serve patients, and our public health information continues to show a downward trend in our key metrics. This obviously represents solid progress as we head into July, and will continue to influence when and how we move into the next phases of reopening the Commonwealth. I can't say enough about Massachusetts hospitals and the tremendous job they've done treating people who are dealing with COVID and helping people get back to their daily routines, and continuing along the way to continue to treat non-COVID patients as well. As I've said many times from this podium, please don't hesitate to contact your health provider about any healthcare concerns you may have, COVID or otherwise. Telehealth currently is a covered benefit here in Massachusetts. Many clinicians and many patients have taken full advantage of that over the course of the past 115 days or so. And Massachusetts, which continues to have one of the very best healthcare provider systems in the country, is open for business and making sure that they are there for you if you need them. Everyone has done a tremendous job helping the Commonwealth slow the spread of COVID. And on June 22nd, Massachusetts was ranked as having the lowest transmission rate of COVID-19 in the country by a group of academics and statisticians that monitor state data. None of this would have been possible without everybody playing their part. Individuals and families have followed the medical guidance by practicing good hygiene, social distancing, wearing face coverings, and staying home if they're sick. It's working for us, but we clearly need to stay on our game. As I've said before, COVID-19 will not be taking a summer vacation, and the way we deal with it should continue to factor that into our daily decision making. And as we've all seen, several other states are seeing sharp increases in new cases and hospitalizations, which is a very real reminder to all of us about just how contagious this virus can be. Everybody should continue to be vigilant in their daily activities, and if they travel as we approach the 4th of July weekend, they should be especially careful. Thankfully, businesses are reopening and all kinds of activities are resuming, and I know that many people are looking forward to planning a few days out of town at some point over the course of the summer. For lots of people, that probably means staying a little closer to home, somewhere around New England or in the Northeast. Massachusetts is reopening, but we want to make sure that our out-of-state visitors are also taking appropriate precautions. Due to lower infection rates across the Northeast region, our administration is updating our state's travel guidance. Effective July 1st, all travelers arriving to Massachusetts, including Massachusetts residents returning home, are instructed to self-quarantine for 14 days. unless they're travelers from Rhode Island, Connecticut, Vermont, New Hampshire, Maine, New York, and New Jersey. These surrounding states, like Massachusetts, are seeing a significant decline in cases and new hospitalizations. Travelers arriving to Massachusetts from these 7 states are exempt from the 14-day self-quarantine directive. In addition, workers designated by the federal government as essential critical infrastructure workers continue to be exempt from the directive for work purposes. Of course, all people are instructed not to travel to Massachusetts if they're displaying symptoms associated with COVID-19. We believe this change reflects the facts on the ground and is consistent with the Commonwealth's approach to COVID-19 standards generally. We're home to many destinations that people usually travel to visit from all over the world, and there's no doubt this season will be different and immensely difficult for visitors and businesses. It's our hope that many folks will still be able to visit their favorite places in our great state. And we've proven that with some changes, a lot of patience and hard work, we can reopen and continue to fight COVID. As everybody knows, we've been battling this pandemic for months. It's been hard, it's been difficult, it's been frustrating, and at times it hasn't been pretty. And it's made it very difficult for any of us to keep up with our daily routines. But we've made a lot of progress in containing COVID-19. Our hospitals are delivering the world-class care that they're known for to non-COVID patients as well as COVID patients, and we've made it through 2 major phases of our reopening plan at a good pace, made possible by declines in key health metrics. We now know there's a long road ahead of us, and we have to continue to play the hand that we've been dealt. And we do not want to take 1 step forward and 2 steps back as we keep climbing out of this horrific pandemic. So please help us stay ahead of the virus and prevent the spread through the simple steps we've talked about before: face coverings, hand washing, hygiene, and social distance. We are enormously grateful for the efforts and cooperation and strong spirit our residents, our employers, and our colleagues in government have delivered time and time again over the course of the past several months. And we look forward to a safe and responsible 4th of July weekend. With that, I'm going to turn it over to the Lieutenant Governor.
Thank you, Governor, and good afternoon. Governor.
All right, that was Governor Charlie Baker there giving us the daily briefing on the coronavirus, and the big news maker coming from that, starting tomorrow, so July 1st, all travelers arriving to Mass, including you if you are out on a vacation right now in a state outside of New England, New York, or New Jersey. When you come back, you now have to self-quarantine according to the governor's directive that he just laid on us all right here. The only real exceptions is if you're an essential worker traveling to any of these other states, but that's a 14-day directive if you travel from anywhere outside of New England or New York or New Jersey, back here to Massachusetts. Also, just to update you on case numbers, 1.9 positivity rate, percent positivity rate in the last 7-day average. 700 plus hospitalized right now, less than 200 remain in the ICU. And the governor indicating that hospitalization numbers today, he spoke with all the hospitals in the state. The numbers are going to indicate a big drop there as well. So something to monitor as we await for today's numbers. As you see, Lieutenant Governor Karen Polito is continuing today's press briefing, so you can continue to check that out for free in our live, in our free mobile app. And for those of you who are on CBS 3 and Fox 6, we're going to send you back to regularly scheduled programming. For all of you here on 40, we'll be right back with some more news. Keep it here.